Foundation training is preventive medicine in the purest sense. It teaches you how to strengthen and control your body in a way that limits existing pain while preventing future breakdown. The first step to foundation training is learning how to access your posterior chain. The posterior chain is an integrated chain of muscles along the back of the body. This chain includes the many muscles of the lower back, hamstrings, and glutes, as well as others which are not the focus of this first video series. When we look at the spectrum of human movement, one thing becomes clear. Most people are currently moving incorrectly, and the most common issue is a lack of strength, stability, and coordination in the posterior chain of muscles.
Without proper function of the posterior chain, your body is not able to move as it is designed. The most common physiological symptom of a weak posterior chain is chronic back, hip, or knee pain due to the constant mechanical stress and eventual breakdown from bending at the lower spine instead of at the hip joint.
Fortunately, when the muscles of your posterior chain learn to work together, your body begins to naturally brace the spine, while the large muscles surrounding the hip joints absorb the forces of gravity, propel you forward, and begin reinforcing healthy, primitive movement patterns. Though it may sound simple, most people do not know how to brace their spine, or how to integrate the glute and hamstring muscles into their movement. In fact, once movement patterns are sufficiently broken down, it becomes rather difficult for a person to access the muscles in the way we ask you to. The reality for some people is that it may take time to return to your most basic movement patterns.
When we say core, most of you out there think abs or front of the body, but education and experience has taught us otherwise. It's aesthetically pleasing to have washboard abs, but we are less concerned with how you look and more concerned with how you feel.
Every exercise we teach in foundation training redefines the core, shifting the focus from the front of the body to the posterior chain and the back of the body. In order for the glutes and hamstrings to work together, your lower back has to be strong enough to continuously support its natural curve. The first couple weeks of foundation training will let you know what it feels like when your lower back is getting stronger. Once the low back is strong enough, the glutes and hamstrings begin to properly move and support the strongest joint in our body, the hip joint.
When movement comes from the hips, your glute and hamstring muscles can both propel you and absorb the force of your movement, while the spine can remain protected and braced by a strong supportive back muscles.
Our body is made to hinge. More importantly, our hip joints are made to hinge. Unfortunately, if your lower back becomes too weak to support the spine against the glute and hamstrings, the delicate spinal joints wind up absorbing the forces that would otherwise be absorbed by muscles surrounding the hips. You guessed it, the posterior chain. The most common reason for back pain is an inability to hinge from the hips because of weak lower back muscles. Herniations will show you exactly where your body is attempting to absorb the forces that your posterior chain should be absorbing. Bending at the spine instead of hinging from the hips leads you down the wrong path. The only person that can fix that is you. For more information on the science of foundation, check out our book, Foundation: Redefine Your Core, Conquer Back Pain, and Move with Confidence.